Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location at the Dulles Cosmetic Surgery and Skin Care Center in Sterling, Virginia, discussing one of the most popular cosmetic enhancement procedures, the tummy tuck, and how it can give you the shape that you've always wanted by removing the undesirable excess skin and fat from your abdomen with Northern Virginia's leading plastic surgeon, Dr. David Berman. Dr. Berman is a board-certified plastic surgeon in both the United States and Canada. He is a member of both the American Society of Plastic Surgeons and the American Society for Aesthetic Plastic Surgeons, and has completed his plastic surgery training and a fellowship at the University of Virginia in Charlottesville. Dr. Berman achieved international fame in the 1990s when he reattached John Wayne Bobbitt's famous missing genital. Welcome, Dr. Berman.
Thank you very much for having me.
Oh, it's our pleasure to have you back on with us. We've got a lot to talk about, a jam-packed show. We've got your interview. We've got two patients coming up that have recently undergone procedures from you.
That's correct.
And you've got before and after pictures as well shortly to show us.
Yes, that's true.
As far as today's topic, the tummy tuck, let me just begin by asking you, if I may, if you can please tell us what it is.
A tummy tuck is a procedure whereby the surgeon makes a low abdominal incision and is excising skin and fat. It's different than liposuction, which is just sucking out fat. We're actually removing skin and fat and usually tightening the muscles at the same time.
So this is more for smaller regions of the tummy, or?
No, it's really the whole region when you have an abdominoplasty.
Okay.
You can do mini tummy tucks, so like everything, there's variations, but generally a full tummy tuck is the whole lower abdomen, and you're tightening the whole abdominal wall.
And what are some of the more common problems that it corrects?
The biggest problem really is twofold. One, some women after having children or not being able to lose the weight will have extra skin. Sometimes they'll have an extra roll, and other times they may actually not have that much extra skin and fat, but they'll have a bowing out of their abdomen so they can stand sideways. They actually can be fairly appropriate for their height, weight, but their abdomen sticks out and they don't like that, so we can often tighten that as well.
All right, and how is this procedure performed?
I always perform my procedures either in a surgery center or frequently in the hospital. They can actually go home the same day if they've just done the abdominoplasty. It involves a long, low incision. I can base it around their underwear or panties so the scar is largely hidden. And then what I do is incise the skin, lift up the skin and fat, actually up to where the rib cage starts, so that I can tighten the muscles, giving them a much flatter stomach, and then excising that extra skin and fat. And the belly button or the umbilicus stays actually in the same location, and the skin moves around it.
And what kind of results can we expect from this, Dr. Berman?
The results are actually very, very striking, and it can really transform the woman's shape. So, and also men also can have it. So it's really
so it's not just for ladies.
No,
Us men can have it too.
Yeah, absolutely. But the results are very, very impressive, and it really is a great operation.
Well, we're going to find out just how impressive, because I believe you have some patient before and after pictures you're going to show us now.
Yes, that's correct.
Let's take a look.
In this first set of photographs, this is a woman who actually had a gastric bypass. She lost 130 pounds, and she obviously has a lot of loose skin. Really not that much extra weight, but a lot of loose skin, with the two different views showing a much tighter abdomen and actually a really excellent figure after the procedure. This is a different kind of problem. This woman has actually quite a good figure. Her big problem is that she has a lot of stretch marks and some loose skin, but doesn't have the huge weight loss the previous patient did. The scars are very faint because it's been over a year, and most of the stretch marks have been removed. And again, she has a much tighter, nicer abdomen. This third set of photographs is a woman who's 33 years old. She's had 3 children and is fairly typical of many of the women that have an abdominoplasty. She has a little bit more weight than she'd like to have, somewhat of a spare tire in her lower abdomen, and a little bit more adipose tissue than she would like. In the post-op film and photographs, you can see there is a scar there. The scar will definitely fade, but the result is a much tighter, nicer abdomen. Virtually all of the stretch marks are removed, and she looks 1,000 times better. In addition, she was now motivated to lose some weight as well, which further enhanced the final result. This last set of photographs is a 33-year-old woman who's had 2 children. She has a little bit of extra weight, but really not a great deal. Her bigger problem is that the weight she has is concentrated in her abdominal area, and she looks actually much fatter than she really is. And this is a result after an abdominoplasty, and she really has a nice, tight, flat abdomen that she probably would not have been able to obtain without the surgery.
Well, you can certainly see the differences in those pictures, Dr. Berman. Very impressive work.
Thank you very much.
Now, as far as scarring is concerned with this procedure, is there very little scarring that results from the tummy tuck, or what are we looking at?
The scarring is definitely much more extensive. In liposuction, it's little tiny incisions. With a tummy tuck, by definition, it's a long, low incision. The trick really is to hide it in your undergarments or bikini bottom, but when that person's naked, there's absolutely scarring. The nice thing is the scarring does fade. It does take time, a year, 2 years. It gets less and less. It never disappears. So really it's a trade-off, but for most women, it's well worth that trade-off.
As far as the downtime is concerned, what are we looking at here?
The recovery is very, very quick. I have my patients up walking the same day. They can go up and down stairs. They're usually back at work in 10 to 14 days, and they really can start doing sit-ups and jogging at 3 to 4 weeks.
So we're not talking about a significant period of time here at all?
No, really 10 to 14 days away from work is all that most women need.
We're now going to meet Patricia and Desiree, who are patients of Dr. Berman. Welcome, Patricia.
Hello, and thank you for having me here.
Oh, it's our pleasure to have you on. Let me just start right off the bat by asking you, what did you have done specifically?
I had a breast augmentation.
And what made you decide to have that?
Low self-confidence. I wanted to fill in my clothes better, and I wanted the whole package. I wanted to feel great.
Now, was there any discomfort or downtime that you experienced as a result of it?
I was out of work I work as a bartender. I was out for less than a week.
That's it?
That's it.
That wasn't that long at all.
No, not at all.
And especially in that job, it requires you to do physical work more so, right?
Yes.
So you were fine with everything going back?
I was great, and I felt great.
That's excellent. Now, I understand you appeared in Playboy as well.
Yes, I'm a Playboy editions, special editions model.
Well, that's certainly exciting. Now, was this was after the breast augmentation?
Yes, after.
How did that come about? What made you go that route?
Well, after having the breast augmentation, I felt great, and I was very comfortable with who I was and in my skin, and that was something I always wanted to do.
Would you recommend a breast augmentation to the viewers that are watching today?
Absolutely. It's much easier. Once everything's said and done, you feel great, you look great. It's awesome.
Thank you so much. On that note, Patricia, for joining us and being a guest today on A New Me.
Thank you.
Welcome, Desiree.
It's great to be here.
Let me start right off by asking you, if I may, Desiree, what made you decide to get a tummy tuck?
After having 2 children, my tummy just had this little bulge that stuck out, and when I was growing up, I always had a flat stomach, so it was really hard after working out and dieting and exercising. It still wasn't going away. It was bothering me.
So you still had that little bit there, and you just
little
felt
bulge, right? The clothes weren't fitting right. I didn't feel comfortable. I didn't have any confidence. I didn't want to go out in my swimsuits, so it just wasn't a comfortable experience.
How long was your recovery time?
Recovery time took a couple weeks. I mean, I think it's still a long process because you actually want to take care of your body and continue to exercise. So I just keep thinking of it as an ongoing experience.
And how do you feel about the results?
I am fantastic. I absolutely love it. I'm wearing more jeans. I didn't used to wear jeans. I'm excited that they actually have swimsuits out now in the stores because I'm looking forward to buying a new swimsuit with my new tummy and showing it off.
Well, you certainly seem very pleased, and I wanted to ask you before I let you go if the tummy tuck is something that you would recommend to others who may be watching today.
I would highly recommend, and I've also recommended some of my friends already. Not only was the surgery great, but the staff that works with Dr. Berman's in the office, the before and after care, they were a tremendous help and helped me throughout the whole process, and they're just wonderful people.
Well, on that note, I certainly would like to thank you, Desiree, for joining us and sharing a few moments of your time.
Thank you.
We're now back with Dr. Berman. I must say both Patricia and Desiree seem very happy with the results, Dr. Berman. And in this case, even though today's topic is the tummy tuck, as we know, Patricia had a breast augmentation done, but I take it that when one is looking to have one of these procedures done, like the tummy tuck, for instance, that you can also have a breast aug or another procedure done in conjunction or in tandem with it?
Absolutely. Many women will choose to have their abdominoplasty or tummy tuck and either have a breast reduction, breast augmentation, breast lift. It's extremely common to combine liposuction, such as to the hips or the side area, with an abdominoplasty as well.
Well, that's how you maximize everything, right?
Yes.
To get the perfect shape that we desire. Now, we've only got a few seconds left, and I wanted to ask you if there are any special patient instructions that one would have to follow after the tummy tuck?
I really try and get them back to normal as quickly as possible. I have them all shower the next day. They get the incisions wet. All the sutures dissolve. All the wounds are covered by Steri-Strip. So there's very little patient care. They sleep in their own beds. They walk straight up. They don't walk bent over. They can go up and down stairs. So I really try and get them back to a normal routine as quickly as possible and get them moving immediately. And I think they feel better for it as well.
Well, that was certainly very helpful and informative, Dr. Berman. And on that note, I'd like to thank you again for joining us and being a guest on A New Me.
Thank you very much.